Well, September is Ovarian Cancer Awareness Month, and it may surprise you to hear while it's the #1 case of death, only about 1% of women in the U.S. have ovarian cancer. And today's CI Health sponsor is Carle, and we have Dr. Beverly London here to share a little bit more. So, Dr. London, I first of all have to say thank you for being here.
Sure.
And this is a topic that has actually recently touched me and one of my sorority sisters, and it just seems like there's just not enough information out there because of how few women it affects, and it seems like there's no really early detection or symptoms for it that women need to be on the lookout for. So while I stop rambling, let's talk a little bit about ovarian cancer and, first of all, where it occurs.
Okay, so it starts in the ovaries, and it can be on the surface of the ovary or inside the ovary itself. Some of the ovarian cancers actually start in the fallopian tube and travel and then attach themselves to the ovary and cause cancer.
So what kind of symptoms do women need to be on the lookout for?
So important that women are aware if you have what we call early satiety, where you eat a little bit and you feel full quickly, pelvic or abdominal pain. If they notice that you have a change, urinary symptoms like frequency or urgency, all those are the top symptoms that women with potential ovarian cancer can have.
Now, there's also some other symptoms, including vaginal bleeding after menopause, or a change in bowel
movements. Absolutely.
So, how long do you wait before noticing these changes before you think, ooh, I probably ought to get in to see my gynecologist?
Gynecologist or your primary or anyone that you can get in to see. But the most important thing is that if your symptoms last after 2 weeks, you want to make sure that you go in to see a provider. So you can try things like taking a laxative, getting some rest, exercise, changing your dietary habits. But if those symptoms persist after 2 weeks, you want to make sure that you get in to be seen and don't ignore those symptoms.
Yeah, absolutely. Listen to your body. But sometimes it's hard to listen and look for those signs that just kind of seem like normal aging, you know, or stuff like that. The case with my friend, it's like it's almost too late once it is found, because now it's like she had no symptoms, and now all of a sudden here we are at stage 4 ovarian cancer.
Yeah.
So what causes it? Like, what do we, I'm guessing maybe it's hereditary?
There's a lot of ovarian cancer that's genetic, so we always want to make sure that when you go to your provider, make sure they have a detailed family history for you. If there's breast cancer in the family, colon cancer, uterine cancer, then we get more concerned that maybe that woman is at higher risk for ovarian cancer. And knowing that risk, we can pick it up earlier.
Okay. Older than 55 or more at risk than maybe younger women?
Postmenopausal women, definitely at higher risk.
Okay, and then there's also the BRCA1 or 2
Yes.
genes.
So the BRCA1 or 2 genes are specifically for breast and ovarian cancer. So a lot of people hear about it in relation to breast cancer, but ovarian cancer is the other part of the BRCA mutation. So women that have those mutations are at higher risk. And also with Lynch syndrome, where you see a lot of early colon cancers, those women are at higher risk for ovarian cancer as well.
Okay. Also, maybe women who have infertility issues or have never had kids could also be at risk. But then people who have had endometriosis
as well. So those are other risk factors that we want those women to identify with.
Okay. How can we test for ovarian cancer? Because it's not through the pap smear that you would normally get when you go to your annual visit. How do you test for ovarian cancer?
A lot of times we start the initial screening just by doing a pelvic ultrasound. So that's a sonogram where sometimes they'll have you drink water before, and they'll do a sono on top of the abdomen and then a transvaginal. And then we can see the ovaries well and see if there's anything that looks abnormal with the ovaries.
Now, is that something you can request when you go to your annual visit? Because why would a woman just say, hey, I want you to do an ultrasound here at this visit?
You'd have to have a reason. You'd have to have symptoms like we discussed, the pain, any bloating, the fullness. Those would be indications to do a pelvic ultrasound.
Okay, so no current test available to test for it when you go to your visit, just a screening like that if you've had symptoms.
Yes, and then there is a blood test that can help determine if you do an ultrasound, you see a cyst or a mass. And women that have gone through menopause, we can sometimes do a CA-125, which is a serum marker. So women that have ovarian cancer will sometimes have an elevated level of that serum marker.
Okay, let's talk about how we can eliminate risk and hopefully prevent ovarian cancer. So earlier detection is key, right?
Yes. So not ignoring those symptoms and getting in to see your provider, making sure your provider knows your family history. So if there's history of breast cancer, uterine cancer, colon cancer, make sure your provider is aware of that history in your family, and being aware, and just not ignoring your symptoms.
Okay. Also, women who use birth control, also that could help prevent?
That can decrease the risk. So especially with patients that have BRCA1 and 2, being on birth control pills, a combined birth control pills with estrogen and progesterone, can decrease the risk of ovarian cancer. And for every 5 years that patient is on birth control pills, it decreases the risk by 20%. So it's amazing in terms of how effective it is.
Wow. Okay. And then obviously it's treated chemo, radiation,
and surgery
to remove the ovaries and maybe like a complete hysterectomy?
Sometimes a complete hysterectomy. Sometimes if it's early, they can remove the whole ovary and get the cancer.
Okay, lots of great information here on one of the most rare, I would say, cancers for women with ovarian cancer. So great to put the awareness out there in September for the month of ovarian cancer awareness. And we appreciate you sharing all that information with us.
Sure.
Hopefully we can make a little difference here and help people listen to their body, know the symptoms.
Listen to your body,
yes,
absolutely.
And what to look for. And then if you do have any problems, you just contact our friends here at Carle.
Yes,
so
we're available.
Yes, we appreciate you all being here today and sponsoring our segment. And if you have any questions, you want to learn a little bit more about those signs, symptoms, treatment options, and how you can connect with the physicians there at Carle, we'll connect you at CILiving.tv.